We're live in 2, 3.
Good afternoon to our panelists and viewing audience. I am Malini Miraj, an assistant lecturer at the Department of Economics at UWI St. Augustine and the moderator of today's Youth Economic Forum. Joining us as co-chair, we also have Mr. Joel Jordan, Senior Administrative Assistant at the Department of Economics. Welcome to all our viewing audience and panelists to today's Youth Economic Forum entitled Bridging the Gap to 2030, the Future We Want, Youth Perspectives on COVID-19. The Youth Economic Forum is an event hosted through the collaboration of the Health Economics Unit, the Center for Health Economics, the Department of Economics, and the Economic Society Unit at UWI St. Augustine. It was initiated in March 2019, and today's forum represents the third of its kind, having successfully hosted 2 others that focused on the sustainable development goals within the Caribbean context. The primary aim is to create a platform to facilitate dialogue among young Caribbean economists on regional issues. It is hoped that the forum will also strengthen youth involvement in policy change and decision-making dialogue and bridge the gap between current thinking and perspectives. Today's forum is, in a sense, a special edition, as we are certainly experiencing some unusual times. Our discourses now have to include terms such as unprecedented times, global pandemic, health crisis, and new normal. We are in an interregnum type of period where at times there is not enough information and other times there is too much information, and where uncertainty can either create panic or create complacency. Despite these challenges, however, we are presented with an unparalleled opportunity to recreate and rebuild. To discuss the way forward, the future we want, we have a distinguished and diverse panel with us today to help us understand what this experience holds for us as a Caribbean region and a society. Joining us are Mr. Ronald James, Dr. Kimberly Ann Gittins-Baines, Ms. Rukiah Scott, Dr. Chani St. Martin, and Mr. Jensen Samaru. I would proceed to introduce each panelist, who would present for 10 minutes and after which entertain 2 to 3 questions. Our viewing audience is encouraged to type your questions on the YouTube chat or send to the email address fss-depton@sta.uwi.edu, and we will accommodate accordingly. Any questions not addressed after the panelists' individual presentations may then be accommodated at the end of all presentations. Starting off today's forum is Mr. Ronald James. Mr. Ronald James is a citizen of St. Vincent and the Grenadines, is currently an economist at the Caribbean Development Bank in Barbados. His core duties include monitoring and reporting on macroeconomic performances and prospects for the bank's borrowing member countries and developing and executing country strategies. He is currently the bank's lead economist for the Bahamas, St. Lucia, and Montserrat, and previously country lead for Trinidad and Tobago. Prior to joining the CDB, Mr. James worked for the International Monetary Fund at the Eastern Caribbean Central Bank. Mr. James, I would now like to invite you to offer your contribution on regional and national macroeconomic impacts.
Thank you very much, Madam Chair, and good afternoon to all. Grateful for the opportunity to participate in this very timely discourse. These are indeed, as the chair mentioned, unprecedented times with significant impact on all areas of life and on all age groups, including, of course, our youth. My task here this afternoon is to take us through the implications of COVID-19 for the Caribbean and the policy responses that some have taken and which might be necessary to take us through these difficult times. In terms of how the presentation will proceed, I will take a very brief look at where were we before COVID-19, take also a very brief look on the global context, the implications for the Caribbean, and then we will wrap up with some policy responses. So where were we before COVID-19? If we look at our countries as far as GDP per capita is concerned, we were doing well for a period of time on average, but thereafter we saw a slight dip since 2016. And with the implications of COVID-19 on us is that we would expect that would fall even further. But more broadly, the Caribbean is faced with a range of difficulties. On the macroeconomic front, we are perpetually in a low growth situation, low commodity prices. We are faced with very high debt. On the productivity front, we rank very low in ease of doing business. We have large infrastructure gaps and weak governance and institutions. In terms of human development, high poverty and unemployment, or we are plagued by those, especially unemployment among our youth. And in terms of environmental, which is a significant challenge which we are going to be facing with, even as we are dealing with COVID-19 now. June 1 starts the hurricane season, and that's another challenge that we have. We have high annual natural disaster costs and the climate change, the challenges of climate change. And at a cross-cutting level, we have significant implementation gaps and a lack of regional approaches to the problems that we face. Since this is a youth forum, it is important to highlight what it is for the youth and in particularly youth unemployment. And as the statement says on the presentation, young people, 1 in every 4 young person across the region, according to the IMF, is unemployed. So that's about a 25% average. Of course, it's an average. So there are instances where 40% is not unheard of, or even higher for youth unemployment across the region. And then, of course, just as a visual of the impact of natural disasters over the years, the most recent being in 2019, Hurricane Dorian on the Bahamas, which cost about 25% of the country's GDP. So that's where we were. Those are the baseline, the platform that got us in which we came into this situation of the coronavirus and the COVID-19. So the global context. So the global economic conditions are at severe risk. The health crisis caused by COVID-19 has caused 2 shocks at the same time, which is somewhat unusual. The demand and supply shock happening together, which leads to the question of a global recession. Already we are seeing advanced economies that experience significant contractions in their GDP, and that obviously would have significant spillover effects on the other countries in the world. Financial markets are under stress, and we have had episodes of severe oil price shocks. Oil prices are expected to rebound later on, but currently they are very low levels. So there's an aggregate demand, and as I mentioned before, an aggregate demand and aggregate supply shock that has taken place. And very basic economics, if we have those shocks, supply falling and demand falling, then the natural fallout from that would be a negative impact on prices. Now, very more often we are concerned about inflation, but the conversation has slowly changing these days to what could possibly be a deflationary condition. And a deflationary condition is just as bad as an inflationary condition. So that's definitely something for us to keep our eyes on. The global recession is likely, as I said before, and the data is showing that all countries are expected to have to be in the red this year, with perhaps the exception of China, in terms of the advanced economies. And as a microcosm of that, as a subset of that, the United States, what we have observed recently is a significant jump in unemployment. Obviously, persons are kept at home. They can't go out to work, social distancing, and so on. And we're seeing unemployment, the April read of 14.7, which is extremely high. As you can see, that has not happened since 1948. The stock market, we have had quantitative easing. The central banks, the Federal Reserve, and others have pumped a lot of money into the economies, and the stock market initially took a hit when the coronavirus was initially coming on stream. Since then, there have been a slight recovery, but notwithstanding, they have not returned to pre-COVID levels as yet. But the authorities across the globe have actually tried to do some things. And so far, they have put out some emergency lifelines to their citizens and businesses. And across the world, about $8 trillion have already been spent to fight the pandemic, with G20 countries actually taking the lead. Now, even in the Caribbean, there have been some countries that have actually spent some monies and have actually indicated that they will be doing or have done some stimulus packages as well. So everybody, all authorities are trying to do their best to do something, certainly on the economic front and on the health front, to reduce the impact of COVID-19 on the population. Now, when we turn to the Caribbean, what we have in the Caribbean is predominantly tourism-dependent countries, and the nature of the crisis that we are facing directly impact the tourism countries. If we look at this table, we can see that by and large, there are a number of these countries that are listed here that have dependency on tourism of over 50%, whether directly or indirectly. And the share of employment, that is in the tourism sector is also very, very high. So just imagine what has happened. Of course, well, you don't have to imagine, we are experiencing it every day. With the tourism sector contracting, the impact that we are seeing on unemployment, on economic activity. So even as the countries have such high dependence on tourism, what has obviously happened is that planes have generally stopped flying. And as the data shows, the red line is showing where we are relative to pre-COVID times. Not only have planes stopped flying, but the cruise ships have also stopped coming to our shores, mainly because of border closures and the various different actions that different governments have taken. So essentially, the tourism industry, which, as I mentioned before, is the primary industry for and primary income earner for a vast majority of the countries in the region, that has basically shut down. But just to give you, I mentioned that tourism is the primary industry, but there's a significant multiplier effect, because even outside of the direct impact that tourism have, there's a range of other activities that are related to tourism. And that is why in some literature, you would see that the share of tourism in the economy would be direct, indirect, and imputed. And if we go through those, we can see that tourism plays an extremely significant role throughout the economy because there are significant multiplier effect from tourism. So the impacts in the Caribbean. The tourism-dependent economies are being affected by the economic slowdown. And I explained why. The main source of economic activity for many countries are really coming from tourism. And tourism has essentially been closed off. The impact is not only being felt on the silver arrivals, like I mentioned before, but it's also on the cruise industry. But there are other economies such as Trinidad and Tobago, for example, which is a commodity-based economy. And what you are confronted with in Trinidad is really a contraction in demand of your main product, which is oil. Now, this is one of those situations where for the supply has not been impacted. Because as we are well aware, there's a significant oversupply, as it were, of oil in the market. But the negative implication of that is that price have actually gone through the floor. So the transmission channel of commodities for Trinidad and Tobago and Guyana and Suriname is really on the oversupply of the product that they're producing mainly, and basic economics with oversupply, prices are falling. Now, if you have pitched a budget, for example, at a certain level, and you're no longer receiving resources or receiving revenue at those levels, the fiscal impact could be very significant. In terms of consumption and investment, supply side disruption to production and trade will lead to sharp or temporary declines in domestic consumption. And we are seeing that. And there are spillover of weak demand to other sectors and economies through trade and production linkages. And of course, health and productivity. With so many of our citizens being exposed to COVID-19, and in some countries we have actually had death. I'm sure that one of my colleagues later on will go through the discussion on the actual numbers as it relates to what we have experienced from coronavirus to date. But that has an impact on productivity. If people are sick or unwell or even afraid to go outside to work, then their productive capabilities are compromised. And with lower levels of productivity, there are going to be a significant impact on economic activity as a result. But what does that look like? If we look at this comparative GDP growth for Latin America and Caribbean, we see two significant dips. One around 2009. Latin America and Caribbean is in gray, and we are seeing another one that is projected for 2020. These are recessionary type fall off in economic activity that we are seeing. So the contraction is expected to be much like we are seeing in the developed countries, expected to be particularly deep as well for the Caribbean and Latin America altogether. Just as an example of one of our Caribbean nations, if we look at these indicative impacts, we ran some here at the Caribbean Development Bank, we ran some simulations as to the possible impact of COVID-19 on economic activity and our fiscal and debt performances. And just to take one country as an example, at the baseline, this country perhaps would have been growing at about 3%. In a low scenario of impact of COVID-19, the GDP will fall by 9%. If it's a moderate, it's about 18%. And if we're thinking about a very deep impact, it could be as much as about 34% or thereabout. Similarly, we're seeing significant increase in public debt as a consequence of slow economic activity on that particular country. Now, the depth and length of the recession depends on the macro measures that are taken, all right? The sooner we do things, or the sooner we take actions to correct or to prevent the spread of the disease and the countries can reopen, the more likely that we can come out of this on the other side and with a new normal, but we would come out on the other side and begin to crawl our way out from the depths of the recession that is likely. In terms of policy response, just to reiterate what I just said, what we have had is that the maximum social distancing, as that takes place, we're having that depth, that fall off in economic activity. But as that curve flattens and people become more confident to returning to work and productivity levels are returning, then you will begin to see economic activity beginning to come back to life. We expect that this could begin to happen maybe sometime in 2021. 2020 is very difficult to see any major economic activity returning to any of these countries in 2020. The policy response is, again, it has to be we have to look at our health systems, our social systems, our fiscal and financial prudence, labor market support. All of these are issues that we need to look at as we are thinking through how we respond to this these conditions, to this crisis. And generally, in a more general way, in terms of how we respond to all of the challenges, and not just COVID-19, but all of the challenges that the region faces, can be listed as the flip side of what I started off as the challenges before COVID-19. The macroeconomic ones, we're looking at economic diversification, strong, resilient financial sector, prudent fiscal management, those are important. In terms of productivity, we're looking at private sector-led growth as important. Human development, good quality education for all is a critical one. And in terms of environmental preparedness, we're looking at having climate change adaptation tools, insurance, proper insurance for both the public and private sector. And as cross-cutting issues, we need to look very carefully at regional integration again. And I think this is perhaps one of those times when we really need to refocus our attention on regional integration. I think we are stronger together than we are separate. Gender equality and gender equity is important. The data is critical. Moving to digital platforms, we've seen how important that has been in these times, and a relentless focus on implementing the policies that we have actually crafted. Thank you very much.
Thank you. Thank you, Mr. James. We have one question so far, and I'm reminding our viewing audience to please continue to send your questions to the YouTube chat, and we will address them as we go along. But Mr. James, a question came about the content of youth unemployment in the Caribbean, and concern is that, is there an understanding of the reasons why we have such high levels of youth unemployment? Is it because of educational attainment or any other reason?
Yes, thank you very much. That's a very good question. Some years ago, the head of the statistics department in St. Lucia did a study on, I can't remember the title of the study, but it was relating to the skills gap. And one of the things one of the main findings from that study is that essentially there are significant skills gap across well, certainly in St. Lucia, and we can replicate that study across the region by and large. There seemed to be a gap between what businesses are asking for and what the education system is producing. That seemed to be the tenor of that paper. And in some ways, I subscribe to that view. I think we need to work more closely with our private sector to really skill our youth for the jobs that they're asking for. That's one. The other one is we have very small economies, and there's just so much that an economy of our size can actually absorb. We are churning out, for want of a better word, a lot more skilled and educated people now than we were before. And it is extremely difficult to find placement for all of these persons if we do not have the right economic conditions that is going to encourage deeper private sector-led growth, so we can allow the private sector to expand further and therefore absorb more of the young people who are coming out. But it really is, I mean, it's a challenge for any policymaker in these current times to really find that sweet spot of having the numbers of young people who are coming out, qualified young persons who are coming out, to be placed into employment. And of course, we need to ensure that our young persons are properly skilled for the current job market.
Thank you, Mr. James. I would like to remind our viewing audience once again to please send your questions via the YouTube chat. Our next presentation would be from Dr. Kimberly Ann Gittins-Baines, who would be discussing health impacts. Dr. Kimberly Ann Gittins-Baines holds a PhD in economics and is a junior research fellow at the Health Economics Unit, Center for Health Economics. She has over 14 years of experience working in the area of health economics, and her research includes health program costing, health behavior, and health-related decision-making, non-communicable diseases and economic policy, aging, child rights and child protection, and health and social policy for persons living with disabilities. Dr. Gittins-Baines, we welcome your contribution.
Good afternoon. Thank you for the introduction, Malini. Today, I will be addressing the health impacts of COVID-19 utilizing the lens of health economics. That being said, I am sure we all appreciate that this pandemic has shown that population health and the healthcare systems do not exist in a vacuum, but have an intricate relationship with the economic system. I would like to start off by saying that this is an evolving situation. The pandemic is not over. Until specific and effective pharmaceutical interventions, meaning therapies or vaccines, are available, countries may need to continue loosening or reinstating measures throughout the pandemic. And so this continued impact, the health impact of COVID-19, will be ongoing. Today, what I will be doing is I will be looking at the impact, the health impact. I will be looking at population health and the healthcare system. According to WHO data, as at May 10th, there were 3,917,366 cases of COVID-19. There were also 274,361 deaths. According to PAHO data, for the 33 countries and territories of the Caribbean, as at May 9th, there were 15,989 coronavirus cases, 693 persons have died, and 4,807 persons have recovered. Within this context, I want to touch briefly on 3 topics related to population health, older persons, the issue of non-communicable diseases, and persons with disabilities. Older persons. According to WHO, although all age categories are at risk of contracting COVID-19, older persons are significantly higher in terms of the risk of mortality and severe disease following infection. We see that data coming out of countries such as China have showed that deaths occurred mainly among individuals aged 60 years and over. And as at March 16th, 80% of deaths associated with COVID-19 in the United States were among adults aged 65 and over. Turning to our region, based on data from CARPHA, for the 24 CARPHA member countries, most COVID-19 cases were among those aged 50 years and over, with the 50 to 59 age group being the modal age group. In addition to being more prone to having severe outcomes from COVID-19 infection and COVID-19 infection, older persons may also experience health effects related to mental health. Given what we've seen, the measures that have been implemented to stem the tide of the virus, social distancing, and in some cases, physical distancing may take a toll on older persons and may result in social isolation. In the Caribbean, we know that with older persons, they tend to have their routines, and they would be part of their social networks in terms of faith-based organizations, where they would look forward to these weekly or events and interactions. So this may be a source of stress for them and may lead to feelings of isolation. They are also, in the literature, we are also seeing highlighted as one of the issues related to the health of older persons is that of the abuse and neglect, which may be escalated during lockdown or stay-at-home orders. So as the pandemic evolves, we, in addition to looking at older persons as a high-risk group, we would also need to think in terms of measures that can be put in place to minimize the mental health impact on them, as well as of some of these measures, these containment measures. In terms of non-communicable diseases now, in the Caribbean, we have some of the highest levels of non-communicable diseases globally. And non-communicable diseases are the leading causes of death in the region. According to WHO, persons with pre-existing non-communicable diseases also appear to be more at risk to becoming seriously ill with the virus. And non-communicable diseases would include cardiovascular disease, chronic respiratory disease, diabetes, and cancer. Under cardiovascular disease, hypertension in particular is one of the diseases which may be of interest in terms of COVID-19. According to the director of NCDs at the World Health Organization, I quote, NCDs remain the world's #1 killer. People living with an NCD are more vulnerable to becoming severely ill with COVID-19 and die from a comorbidity. NCDs are hidden, misunderstood, and underreported in the COVID-19 response. So as we move forward, given that the region has been grappling with this issue of NCDs, we need to be fully aware of the implications for persons with NCDs. They have to continue to receive access to the services that will help maintain their health, even given what we see has been happening in terms of in other parts of the world in terms of supply chains and access to pharmaceuticals. Persons with NCDs will need to continue to be able to access the care that they need to maintain their health. And I just want to touch briefly as well on persons with disabilities. According to, again, WHO documents, persons with disabilities may experience barriers to implement basic protection measures such as hand washing and maintaining physical distancing. And this is something, as we go forward, we have to look at ways that we can ensure that public measures also reach persons with disabilities. For example, the hand washes in public places being wheelchair accessible. Turning now to the health system, which is the pillar of the response to COVID-19, we know that many ministries of health throughout the region have mobilized resources to treat with COVID-19 and have had to source additional funding to finance spending on scaling up the response in terms of medical equipment and supplies, human resources, and infrastructure. Increased demands have been placed on the health system in terms of the resources required to treat with the pandemic. COVID-19 has hit countries with a double shock, both health and economic. This is coming out from a situation where health systems were overstressed and underfunded in many countries. And to have to grapple with now this economic fallout from the pandemic will put a further restraint on nations' fiscal capacity. So in the first instance, we would have this ramping up of the requirements now for the health system to treat with the pandemic. And following on from that, as restrictions begin to ease in countries, we will now need to address the accumulated demand for services that may have been crowded out during the early stages of the COVID-19 outbreak, where persons may have avoided care out of fear or caution. And now as restrictions begin to ease, persons may tend to seek to access care, and the system will have to deal with that backlog. In the healthcare response, one of the key components here that I want to touch on briefly, given time, would be healthcare workers. This pandemic, one of the things that we've been reminded is that our human resources and health are an essential part of the delivery of quality healthcare. Prior to COVID-19 and looking at the Sustainable Development Goals for health, ensuring healthy lives and promoting well-being for all at all ages, the WHO had estimated that there would be a gap of about 18 million health workers in 2030. And that this gap was fueled by migration, threats to workers in conflict zones, and inadequate funding to support health systems and higher health professionals. That was pre-COVID. Now, within the heat of the COVID outbreak response, we have our health workers at the front line, and based on WHO data, as of the 8th of April, there were 22,073 cases of COVID-19 in healthcare workers from 52 countries. Our healthcare workers are now faced with pathogen exposure, long hours, psychological stress, fatigue, and in some cases, they may even be faced by stigma and discrimination just by virtue of working in health. So as we go forward, we need to be cognizant of the impact on the health of our healthcare workers, both their physical health through exposure, potential for exposure to COVID-19, and their mental health as well. Now, given all we have discussed and the theme of this session, how do we build the future we want within the context of COVID-19, particularly within the context of Sustainable Development Goal 3, to ensure healthy lives and promote well-being for all at all ages? Well, I'd like to quote from the Deputy Secretary General of the UN, Amina Mohammed, where she said that this crisis has already demonstrated that massive change can be brought about if there's political will and a unity of purpose. The Sustainable Development Goals are no longer an aspirational set of goals for some distant future. They are the minimum we need to secure a safer, more just, and more sustainable world for all. So I would like to end with those words that it is achievable once we have the political will and we work together, given that this would be the bare minimum to achieve goals, our health goals, and the resilience of the health system would be key. And this is one of the things that COVID-19 has shown us the importance of resilience. Thank you, and I hand you back over to Malini.
Thank you, Dr. Gittins-Baines. I think it is very interesting as we consider all the dimensions for assessing the impact of COVID-19 and you know, understanding that our societies are so diverse and our Caribbean region has so much diversity that it's not going to be the same solution for everyone and the same approach that will address the issue of COVID-19 for all members of society. So thank you for highlighting that we need to look at the specific needs of the elderly, of persons with disabilities, of those with non-communicable diseases, our health systems, our healthcare workers. So we realize that the approach is not going to be a one-size-fits-all approach, but rather one that has to reflect the nature of those affected and our respective vulnerabilities. Again, I would like to indicate that viewing audience can send your questions to the YouTube chat. We are taking note of them, and those that are not answered immediately after each presentation would be addressed at the end of all presentations. Discussing the social impacts with a focus on gender implications, we have Ms. Rukaya Scott. Ms. Scott is currently an undergraduate student at the University of the West Indies, pursuing her Bachelor of Science in Economics with a minor in Environmental Economics. She is also the Executive Director of Project SMILE, an NGO focusing on youth development through education, and a member and the incoming Professional Development Director and Public Relations Officer of the Rotary Club of Central Port-of-Spain. Ms. Scott is also a former Trinidad and Tobago Youth Ambassador to the United States. Currently, she is the Deputy Interclub Committee Chairperson of the UWI Guild of Students, the incoming Deputy National Affairs Committee Chairperson, and the President of the Economics Society of the University of the West Indies, St. Augustine. She is also a public speaker on issues ranging from women's rights, the rights of the differently abled, LGBT rights, human trafficking, refugees, migration, and climate change. I would like to welcome Ms. Scott to offer her contribution.
Thank you very, very much. So in addition to the economic and obvious health implications of the coronavirus, I'm going to touch on the social implications. Now, as a Caribbean people, it is our culture to be outdoors and interacting physically with each other. And we have possibly one of the most colorful and vibrant cultures. And the safety measures implemented due to this pandemic is something that we're not accustomed to. I myself, as a young person, I love to go out and line with my friends and family to go to a party every now and then, you know, the restaurants, the movies, the beach. And for some of us, we go to the beach quite often. Some of us, it's once a week. Some of us, it's twice for the month. And then there is an uncertainty with our religious and cultural festivals also. Eid is around the corner. There is Diwali, there is Christmas, and a large one, Carnival 2021. And for a lot of us, and I'm sure I speak for a lot of people, Carnival is such a major festival that we don't know how we're going to manage with Carnival being not happening, right? Accompanied by that, with the unemployment and the uncertainty of the state of economy, it puts us all in a state of fear. We're constantly worrying about how are we going to make ends meet, what is going to happen with our jobs, and it contributes negatively to our mental health, causing stress, anxiety, and depression. Now, these challenges we're facing in the region is not unique to us, and countries all over the world are grappling with similar effects. The United Nations Department of Economics and Social Affairs indicated that the coronavirus is detrimental to various vulnerable groups. Persons living in poverty obviously face dangers of being able to put food and even face dangers with their homes, the security of their homes. And we can see examples of that here. I mean, the public and private sector doing their best to get food hampers out to persons who are in need. And we even see instances of some persons facing eviction from their homes. Older persons are less capable of supporting themselves in isolation. And then due to the discourse around COVID-19, in which it is perceived to be a disease of the elderly, it exacerbates negative stereotypes about older persons who may be viewed weak, unimportant, and a burden on society. And likewise, with persons living with disabilities, they face challenges in accessing healthcare, and they are also unable to take care of themselves in isolation. And then there is the usual stigma and discrimination against persons with disabilities also. Another vulnerable group identified by the UN is youth. And as a young person myself, I am directly affected by this, is that globally over 1 billion young people are currently physically not in school because we have to depend now on technological means for our education. And we know the issue with that is we have the digital divide, and then we also have the gender gap amongst that. So those are the overall arching social implications of the novel coronavirus. So to take it a step further, we now look at the specific gender implications. Now, to understand this, we need to understand gender, we need to understand sex. So sex refers to our biological characteristics that make us male or female. Gender is the social meaning given to those biological differences, and it is a social construct that seeks to determine the social roles and behaviors associated with masculinity and femininity, which changes over time, and it is obviously different across cultures. And we can see how gender dynamics are changing in the Caribbean. Males and females are no longer in this sticking to these traditional roles and responsibilities, and gender equality is becoming a much larger movement. However, due to the pre-existing inequalities, the impacts of COVID-19 on women and girls are exacerbated simply by virtue of their sex. And therefore, it is within this social construct is the reality we live in, where men and women are not regarded equally, and the disparity between men and women is prominent. And as a result, we should recognize that this pandemic is going to affect both men and women, but it's going to do so differently. Now, data shows us that men are more likely to experience more severe cases of COVID-19 due to biological systems, pre-existing health conditions. Men are more likely to engage in smoking than women, and men are also more likely to engage in large social interactions and gatherings. Statistically speaking, in one subset in China, 70% of the COVID-related deaths were men and 63% in Europe. And in the Caribbean, namely in Jamaica, Barbados, and Trinidad, majority of the COVID-19 deaths have been amongst men. And then there is due to the social conditioning of what it means to be masculine, that traditional view that we have, it gives some men the ideology that they may be invincible to the impacts of COVID-19 and makes them more resistant to follow the restrictions imposed by the government. The health sector itself employs both men and women. However, majority are female, and it leaves them at a higher risk of contracting the virus. The care economy, for example, consists of jobs that are often low quality, poor working conditions with low wages, and some jobs being completely unpaid for. And the reality is that women are likely to do these jobs 3 times more than men. So what about the single parent homes that are both either female-led or male-led, who depend on the salaries of their mothers or fathers who work in the health sector? What would happen if they were to contract the virus? And then granted that majority of single family homes are female-led, it leaves us asking the same questions. Another major concern for women is the access to sexual and reproductive health, which is a challenge faced by women from lower socioeconomic backgrounds. And with the attention given to COVID-19, there is the overlying concern that women may not be treated with urgency and may be neglected. And there was an example of this in Jamaica recently in April, where a woman died shortly after giving birth after she was turned away from multiple health facilities. And it's been a discourse in Jamaica that in the face of this pandemic, other health-related issues need to be dealt with, and we need to make sure that women aren't denied their basic health care they are entitled to. With respect to employment, there are men and women who have been retrenched or terminated and have experienced reduced income. In households where men are the sole breadwinners, a reduced or no income can impact the family. Likewise for female-headed households. And we might even recommend, like in this economy, it's not always the best option to have one source of income, and you can have alternative sources of income. But amidst the pandemic, this is difficult to do. So the income reductions pose the obvious financial stress of households, resulting in persons having to face evictions from their home and obviously poverty. Linking to sexual and reproductive health in the Caribbean, we have a fair share of period poverty, which is that's when women aren't able to access sanitary products at an affordable price. And it poses a greater concern now with the amount of unemployment that we're having. So one of the upsides of these lockdowns is that we get time to spend with our family even more, creating a greater sense of family. However, at the same time, the stay-at-home orders have also resulted in an increase in domestic violence. The Trinidad and Tobago Police Service reported in February that we had 73 reported cases, and it rose to 96 in March. Overall, domestic violence cases went from 232 in 2019 to 558 in 2020, and we're not even through the first 6 months. So gender-based violence and violence against women, it's nothing new. In fact, due to our pre-existing gender inequality systems and the inability to prevent persons from engaging in domestic violence, with the impacts of COVID-19, the rates have worsened. Now, a big topic is technology. Utilizing technology in business and education is likely to become part of our new normal. However, considering the digital divide amongst socioeconomic positions and also the gender gap amongst men and women in technology, this new normal with technology will disproportionately disadvantage persons. Globally, the gender gap stands at 250 million fewer women than men online. Women are much less likely than men in the same age group and at similar educational and income levels to use the internet. And women are 30 to 50% less likely than men to use the internet for economic and political empowerment. So that brings us to the reality. Men and women are different, biologically we're different, so our needs are unique. And in order to have an equitable society, we need to remove the gender inequalities that are pre-existent. This year, 2020, marks the 25th anniversary of the Beijing Platform for Action, which was intended to be groundbreaking for gender equality. Instead, with the spread of the COVID-19 pandemic, the limited gains made in the past decades towards gender equality are at the risk of being set back. So we need to define what is our new normal and how do we want our country to look post-COVID-19. Now, more than ever, applying a gender lens when implementing policies will be extremely important. We need to utilize the tools of intersectionality and pay attention to the needs of women and men across all races and socioeconomic backgrounds to ensure that we derive the best from our women and men and to ensure that gender inequality is something that does not persist. And the reality of the situation is, at the face of any crisis, women and girls are always left at the greater end of the atrocities. And we need to make sure that we protect them so that going forward, because this isn't the first pandemic, this isn't the last pandemic, and the Caribbean region is particularly vulnerable to a myriad of external shocks. So going forward, it's important for us to pay attention to the men and women in our society and cater to their needs directly. Thank you.
Thank you, Ms. Scott. Very engaging and very informative, and I may also say possibly controversial. Based on that, we have two questions that I'd just like to pose to you quickly. Question one, what can you say about the possibility of an increase in domestic abuse during the pandemic, and how can we combat this? Question two, if you would like me to continue, or if you would want
Yeah,
to.
you can go ahead.
Could gender responsive budgeting address some of those gender implications that you have identified?
Definitely. I love both those questions. Okay, so to address the first one, domestic violence statistically has been increasing in the Caribbean due to COVID-19, and not just in the Caribbean, but globally as well. Now, the issue with domestic violence, what happens is we get a lot of victim blaming the woman, saying that, okay, there are things that she would have done to exacerbate the man's reaction or her partner's reaction. In my opinion, we need to change how we view domestic violence. We need to look at it as a crime rather than look at it from a point of victim shaming and blaming. So what happens is that there are a lot of psychological issues that happen within a marriage or within any relationship that have two partners, right? And a lot of the times, our men are suffering from a lot of stress, depression, anxiety, a lot of frustration, because you see what patriarchy has done, the social implications of patriarchy affects men and women. So all the pressures that come with maintaining this masculine persona, it's something that is not toxic. Masculinity is not healthy for men. And what it does is that it creates a situation where we don't teach our young men or men in general how do they deal with their frustration, their anger, or whatever emotions they might be going through. And unless we tackle that angle, we're gonna have domestic violence, because I know the Trinidad and Tobago Police Service has a gender-based violence unit. However, we want to prevent the reports from happening in the first place. And now with the pandemic and now everybody is at home, it's a cause to greater concern. So that's why I think we need to focus on rather educating our men and women. How do we handle the dynamics of conflict in life in general? What do we do and what do we not do in order to solve our conflicts so that we can prevent violence against anyone from happening in general? And in terms of domestic violence, if I may add, there is a misconception that it's only women alone who experience domestic violence. No, we have men also, but the statistics is that women face more. Actually, 30.4% of women globally live with the fear of being sexually assaulted versus the 11.1% of men. And whilst these statistics are not representative of society, because we do know that men are less likely to report instances of violence, that is also another reason why it is we need to educate everyone that violence on a whole against a partner or against any other person is not acceptable, and that we should encourage everyone to speak out against it and report it when it does happen. And that all stems from redefining what is femininity and what is masculinity, and that is why we need to address gender. So that takes care of the first question. The second question with respect to gender responsive budgeting and if it will be something that we can utilize to ensure that we have gender equality, definitely yes. The fact is, every dollar and cent lands on men and women differently, and it affects us differently. And if you look at the labor force and we look at the sectors that we have in our labor force. So let me give you an example, right? Let's say in the next budget, we want to amp up construction and manufacturing. When we look at those industries, the majority of employees are men. So if we pump more money into that sector, the money is going to land on men. However, if we don't pay attention to the care economy, if we don't pay attention to our nurses actually, and let's say there isn't much given there, then it's disproportionate. So that is why through a gender lens, using a gender lens means identifying all the needs of men and identifying all the needs of women, and then using the budget to ensure that it is equitable, not necessarily equal, but it is equitable, so that we ensure that men are benefiting and we're ensuring that women are benefiting. Because the reality is, the disparity in how we view and treat men and women in this country, it is prominent, and not just in Trinidad and Tobago, but in the Caribbean and internationally. So I definitely think that gender responsive budgeting is a great tool that we can use in order to combat these issues. Thank you.
Thank you again, Ms. Scott.
No problem.
So audience, I think we need to take note of all the dimensions of development that we've covered so far. While we have started the forum with a macroeconomic perspective, we have thus far spoken about health and gender as well. So this now highlights that economics goes beyond GDP and what is happening to macroeconomic indicators, as they are important, but more so what is happening to human development, what is happening to social development. To discuss environmental challenges and food security, we have Dr. Chani C.G. St. Martin. Dr. St. Martin is a national of St. Lucia. He is an international specialist in water and soil management and climate innovation at the Institute for Cooperation and Agriculture, hosted in Trinidad and Tobago. His responsibility is to provide technical cooperation and developmental services to the 34 participating countries of the OAS, including Caribbean, North, South, and Latin American countries. He has over 20 years professional experience in agriculture in the Americas at the national, regional, and international level. Dr. St. Martin is committed to and passionate about working with professionals to create meaningful change through innovation, institutional strengthening, strategic advocacy, and capacity building geared towards fostering resilient systems and communities, particularly in the area of water, soil, and crop management. Presenting on environmental impacts with a focus on agriculture and food security, I would like to introduce you to Dr. St. Martin.
Thank you for that, Malini. Thank you, moderator, for that introduction. I also would like to thank the audience for sharing your space. And by extension, I'll also like to thank the Economic Society and also the Department of Economics and UWI St. Augustine for hosting this event. I do think that it is fundamentally an important event, and it's not because of just the pandemic situation, but it goes beyond that, where we are addressing practical societal issues, and therefore we cannot continue addressing them in isolation. It cannot just be economics. It cannot just be a social issue, but we have to get within that process where we discuss these systemic issues. We always have that more philosophical and more inclusive way of doing that. And by all means, that is reflected in the panel here today in terms of the different perspectives that are presented so far and are going to be presented afterwards. So I would like to applaud the university for that, first of all, and to change the old age dynamic of economics to something that is more encompassing. I would also like to point that because of this, we are dealing with what I would consider a systemic hack. And on any of y'all that deal with computers, we know that when we talk about a systemic hack, we are talking about something that essentially threatens the very functioning of your system. And likewise, I would like to make that similarity as relates to society and that construct of civility that we have come to know and be accustomed to. And I want to fundamentally say that these are the effects of something that is systematic, something that we have not, that is not warfare in terms of the customary warfare that we know, but it is something that it is very simplistic in nature, but the rippling effects is very damaging. And so therefore, I would like to urge us from the beginning as we go forward to realize that, first of all, the way that we actually educate and we address, even at university levels, with that level of compartmentalization, nature itself does not operate or relate to some of these problems like that. And therefore, it emphasizes the need to actually work together. And that is a fundamental thing going forward. The other issue I want to address very quickly here, and I think it's the opportune time to do that, I would also like to state a disclaimer here that essentially, what are my perspectives, the perspectives that I'm presenting here, does not in part or in full reflect that of the institution that I work with, but they may be related. And so therefore it is not to be construed that this is the fundamental ideas or the thinking of any institution here. In the presentation, what I'm going to do, and I want to give a general points about food system, but more so the general thinking about development and not just the issue of environment, but more so I'm going to ask and have through the thread the issue of the Caribbean thought and the Caribbean identity in contextualizing and actually developing things that are pertinent, whether it's a response to shocks, COVID, etc., which I think by and large have been related, particularly among youth, that systematic continuation that we need. And so therefore, a lot of we are caught in a position where we are often rambling or trying to put things together as opposed to be at a proactive point. So these are very important. And I want to extend this by fundamentally showing that by the nature, food systems and also agriculture, it has a function, it has a multifunctional role, meaning that we are not only talking about food production here, we are not only talking about the supply and demand of food, but we are talking about a culture that is associated with that, that can be branded so that we could have the economics return. And so therefore, agriculture has a pivotal role, food systems have a pivotal role in developing rural areas. And the fundamental essence of life, which is your basic needs. And I would like to present this argument because I'm going to address several themes through the presentation, but I want to start by categorically stating, and that is very contentious, that essentially, when we look at things around, it seems that we do not have a food or agriculture problem. We may have a people problem in terms of how we deal and how we value things. And I'm going to use the rest of the presentation to underline some key thematic points that may be related to that. And I also want to emphasize, just as we have, that there are issues of, if we perhaps would think of or respond by issues of panic farming as opposed to panic, then you could see some of the issues changing around. So in my presentation or in my talk, obviously I don't have a PowerPoint here, but I hope to share some very interesting and powerful points with you that really center around this. When we are dealing with this issue, we are talking about essentially mismatches and upside downs and all efficiencies in the prioritization processes and the related stamina to connect two issues, particularly to connect the households directly to the issue, to really correct the vision that we are connected directly, the households connected to these things by aggregate functions, whether it's a demand, whether it's a supply function, the household and family are not divorced from these issues that we talk about when we talk about food security, nutrition security, etc. So I want to leave that point here. So essentially, I'm going to give some arguments or some presentation to show how definitely we have had some mismatches in the fundamental thought processes that when we are either confronted with shocks or when with the shocks. And because of these mismatches, these upside downs, these deficiencies, we are often not in the position to solidify our response in a manner that is sustainable so that it could be continued and championed by the youth to get the outcomes that we so often desire. So on the point of mismatches, I want to, again, bring out the issue about effective communication and more so effective talk. When I was asked to do this, the first thought that was on my mind is how are we effectively changing the discourse or using the talk to translate into a change of behavior, meaning that there have been so much already written and spoken about the COVID and other pandemics. Isn't the issue how do we translate or invest or invest in more effective talks so that you have a quicker translation into action. And that, I think, is one of the key things that we have to address, and the youth also has to address. How do we effectively or minimize or be more efficient or effective with our talk in our discussion processes? Yes, it is useful, but at the same time, how do we reframe our minds so that we are not too dependent on the issue of a problem as opposed to emphasizing more thought processes on how we solve the problem. And I'm going to give you one of the examples here. And before I do that, I am not going to, in this presentation, rehash most of the things that have been said about the food system and also the environment, simply because I think that it is my responsibility to simply point you to the direction and some of the conversations that have been had on COVID. One of these presentations was just last week held by the CARICOM, where they looked at enabling agricultural investment in the Caribbean, and they're looking at a post-COVID-19. And of course, the critical points of the $6 billion import bill, food import bill, the issue of the Caribbean not being a net importer and not producing and exporting food as much as we should, even if we have the land mass to do it. And I would dare say the skill set to actually do that. There was also arguments presented as to how much really of the money that we are earning from any industry actually goes back to food. And also the issue of what are we going to invest in now and how are we going to, these have been sufficiently addressed, and the PowerPoint presentations are there by presentations that were given at the CARICOM, recently held CARICOM webinar, and also during a presentation that was made by the Faculty of Food and Agriculture, where they specifically spoke about agriculture. And you had there Dr. Listra Fletcher, who has done tremendous development work over the Caribbean here. And I also want to point the viewers to some presentations that were made by the very HUU here. I remember looking at a presentation by, or listening to a presentation by Professor Carl Theodore, and I'm sure that there are others planned as well as there are other presentation plans to actually hear the voice of the producers by the Faculty of Food and Agriculture. My institution have also done it fair work here, which I'm going to talk about sometime later. But on the point of mismatches, and that first mismatch that I wanted to identify here is a mismatch between the intellectualization that does not translate into a change of behavior as evident by a new way of living, which to me is the essence of education. And so we have this recycling of thoughts and recycling of interesting discussion that somehow does not translate in our lives so that we could have new discussions. So I want to point that there as one of the things that we have to think of on how we go forward and discuss that and remedy that. I also want to bring to the fore an issue of what if we are now producing sustainably and we have sufficient production? There's also a mismatch where what I refer to as the unsustainable palette. The unsustainable palette meaning that we have to address the fundamental issue of what our preferences, our food preferences, and how are we planning to address that? Because even if I have a plate in front of me, totally locally grown food, and we who have kids would know that, if that is not being consumed or if that is not being preferred, because we essentially have an unsustainable palate, meaning that our tongues, our tastes are for something that does not presently exist in our local context, then we have a dynamic that must be addressed and that will not lead to that outcome of food security, food sovereignty that we would like. And so I would like us to think of that and put that in the table, as well as waste management, unsustainable waste practices as well. And on that note, I want to very clearly say that there is an opportunity for the youth to actually look at and earn from an independence, to win an independence, a true independence of an independent palate. On that note, I also want to just quickly put the point of the exaggeration and the whole issue of the super concept. A lot of things are related to super concept, and again, it has implications for the environment. And one of the things that we could talk about is things like, again, supermarkets and also supernatural, superfoods, etc., where the amount that you actually have to put into these things, and one often wonders, how do we have these things that perhaps do not holistically represent what is being produced in the country. Although I must say that the supermarkets and the other super concepts, they are definitely going that trend, but I think that there's much left to be done as we talk about food systems and environment going forward. One of the glaring issue, again, for the youth, and I took very careful notes about this, and that relates to my theme of upside down. How do we have essential workers who do not receive the essential pay and non-essential workers, meaning that what is the variation there? How could I be so essential, however, the value of that essential thing is not being reflected in my remunerations or how much that I'm being cared for? And that has serious implications for food production. And we have seen that systemically in food production system in the Caribbean, whether it's agriculture or the processors, where you have people that are fundamentally in charge or has a role to play in producing food, the basic needs. However, when you look at the remuneration or when you look at the prospects of that, you do not see that match in terms of the importance. And again, I'm not saying that it should, but I think that if we're sending out that message, we need to also send out how are we going to solve that. And definitely connected to that issue, obviously, is the whole issue of what I would consider the deprofessionalization of agriculture and the underappreciation of persons that work in the food system. Obviously, that is related to some of the historical issues and some of the prioritization issues. But amongst the COVID and even pre-COVID, these are some things that have to be discussed as to how we go forward. So this was the general concept. And I think all of these things are very important before we delve into the environmental impacts and other issues of the food system. I want to start by saying, as it relates to the environmental impact, essentially what we could do is to look at it from several dimensions. One of the dimensions being, of course, the climate change dimension, where we're looking at the issue of emissions, what we call greenhouse gas emissions. And by all reports you'll see with the BBC as well, we are seeing that there seems to be a temporary net positive effect or impact of corona as it relates to that, simply because you have the reduction of activity, production activity, particularly those that are related to the heavy consumptions of fossil fuels, etc. And you also have, again, the reduction in flights and whether it's cruise ship visits, etc. We have that. So you have seen that in the emission of greenhouse gases. However, I want to quickly state here that all of this stands to go away if eventually after that we have businesses that are engaging in what I call compensatory production or catch-up production due to losses that suffered during Corona. I also want to quickly point out that while we have a reduction in the greenhouse emissions and you have that relay in terms of the improvement in the quality of air, there have been a tremendous increase in waste generation, particularly medical waste. And so therefore, this is an issue that again has not been brought to the forefront, but it needs to also be discussed. We have had a waste problem even before COVID, and we will continue having it if we are not able to really discuss and put systems in place to actually address this here. The other issue, the environmental issue that is very important as well, is that although the Caribbean is not a net producer of the greenhouse gases, the issue that is important for us is that we are facing that impact of it. And so therefore, the main issue for us is how do we adapt to it and how do we actually connect or get the climate finances to deal with the impact that has been created more by more industrialized state. And that is a fundamental thing going forward that has to be discussed. And that is what I'm talking about, the Caribbean thought and an identity and connecting to environmental problems. And so we have done some work on that and continue to do some work on that. But essentially, this is a point, and economists as well need to join in very deeply on that. How do we actually finance the shocks that we have, these perpetual shocks that we have, and the multi-shocks, not just the pandemics, but the hurricane, etc. So this is some of the things that we have to discuss as we go forward. As it relates to the environment, again, what we have seen is that some of the pollinators, we have seen that the environment is more amenable now. We are seeing some evidence of some of the pollinators like bees that are essential for pollinating the crops. The numbers are increasing, etc. But again, this needs to be maintained even after that, so that we definitely could translate that into something that produces or is related to what we call natural capital and food and nutrition security. What is evident as well is that there are severe cuts in agriculture, and that has resulted in a lot of the organic waste as well. And again, that is the waste problem that, again, for environment, we have to be concerned about. The last point that I want to just quickly, the last 2 points that I want to quickly mention here is that there's also a political issue, meaning that with the COVID-19, what we have is the postponement of the 2020 United Nations Climate Change Conference, which is very pivotal in terms of the political discussion and direction as it relates to things like green energy. And so therefore, all that political will and possible action is delayed. And so therefore, this is something that we have to contend with, and we have to see how we deal with that going forward. So in conclusion, I want to say that essentially, we know that things are not going to go back to normal unless we have that vaccine, corona vaccine. Neither should it, in my opinion. I think that in the Caribbean, we are not wanting for ideas, but we are wanting for actions and sticking to these actions to obtain the outcomes. I also want to say that it is essential that we appreciate the culture that we had before and learn from it and see how we could actually use some of the resilient surviving thinking that was embedded in that to move forward. And I want to categorically identify the role of the youth simply because they are the ones most accustomed to dealing with systemic hacks, whether you go from a computer level to an entire system level. And I want to, again, also highlight the work that has been done by institutions like the Inter-American Institute for Cooperation and Agriculture in terms of doing that, merging art, science, and agriculture. I also want to highlight some of the work that has been done by NGOs like Y Farm in terms of rebranding agriculture so that it is more appealing to the youth, and also an ICA Foundation, which is using agriculture in therapy, etc., underscoring the multifunctional role of agriculture. So with that, I say thank you, and I await your questions and deeper discussions into some of the issues that I raised. Thank you.
Thank you, Dr. St. Martin. We do indeed have quite a few questions that have been posed to you, but in the interest of time, I would just ask 2, and perhaps we can revisit the others at the end of the other presentation. So the first question is, what do you think about getting the Dominican Republic into CARICOM post-COVID-19, and whether you think that it will help our development through more trade?
Right, thank you for that. I want to first start by saying that my weakness is on political matters. My strength is really on technical matters. I would definitely say that if we're going to make that decision, it has to be an informed decision. I do understand the point that the person that asked the question is bringing, but I would say at this time, for me, I would have to weigh the arguments as to why to do that. And I'm sure that it is being done on the CARICOM level. And it definitely wouldn't be my task to decide here. But there are benefits to actually doing that. And I wish that at the CARICOM level, they would decide on that, whether it's for a food system argument or an environmental argument. Thanks.
Just a second question before we move on. What do you think about using hydroponics for local food production instead of traditional farming practices?
Right, thank you for that again. Again, I want to, and that I think is a point that is very close to my heart. We often engage in arguments about either or. I don't think that is an either or argument. I think that when it is relevant and when it's pertinent, there's a place for hydroponics, there's a place for traditional farming. In fact, I also think that the majority of the food that we produce now, particularly on a small scale level, it is from the outdoors. That doesn't mean that there's a need to transit outside of traditional farming, but I do think that we need to get a very good balance and actually show the contribution as to how we are developing agriculture and how we are using some of these technologies to attract persons to agriculture. Thanks.
Thank you again, Dr. St. Martin. For those of you who had posed other questions to Dr. St. Martin, we would try to revisit them and accommodate them at the end of the other presentations. I would move on to introduce Mr. Jensen Samaru. He will speak of the role of international organizations. Mr. Samaru was born in Guyana. So far we've had St. Vincent and the Grenadines, Trinidad and Tobago, St. Lucia, and now Guyana. So we do have a rich diversity being represented here. He is currently a full-time student at the University of the West Indies, St. Augustine campus, with his primary interest being in law and political development. But generally, he's interested in making the Caribbean a more developed, united, and socially just one. He is currently the International Affairs Committee Chairperson-elect of the UWI St. Augustine Campus Guild of Students Council. His intention and interest is to represent the rights of people in the courts of law and contribute as much as possible to Caribbean and global development. I would like to welcome Mr. Jensen Samaru to offer his presentation on the role of international organizations.
Thank you, moderator, for that very warm introduction. At the outset, I would like to begin by thanking the organizers of today's event for affording me this opportunity to be a part of this panel and contribute to this ongoing conversation. I would also like to take this opportunity to say that the views and opinions that are expressed here are those of myself and does not represent the views held by either the outgoing or incoming Guild Council on which I currently sit. Now, I have been tasked today with presenting on international organizations, both during this pandemic and in a broader context, what they have been doing, continue to do, and perhaps will do post-COVID-19. Now, as we know it, has undergone many changes over several decades, millenniums, and centuries. Many of these changes have oftentimes occurred directly as a result of some event or a series of events. We have read about events happening in the past, but no generation has been made to grapple with a pandemic which has impacted every development program has labeled the COVID-19 pandemic as the defining global crisis of our time and the greatest challenge we have faced since World War II. We can surely testify that the interconnectedness of our world is now more apparent than ever, and the COVID-19 virus surely has no regard for borders and sovereignty. Perhaps we can now rightfully say that borders only exist in our minds. This global pandemic has called for a global response, and in that regard, now more than ever, the international governmental organizations, and for ease of reference, international governmental organizations, are simply those institutions whose scale of coverage and activities span, at the very least, across 3 countries. There are currently over 250 international governmental organizations.
I think we may have had some connection problems with Jensen Samaru. So until we reconnect, I would like to encourage you to continue to send your questions to the YouTube chat. As I said, we would try to accommodate them as we go along. As we wait for Jensen to reconnect to us, we can perhaps address some questions that were sent earlier. There was a question and somewhat of a comment that was produced for Mr. Ronald James. The question was presented by Professor Carl Theodore, and Mr. James, Professor Theodore is asking if there is any sense of the rebound time for tourism and what should we focus on in the meantime?
Professor, good afternoon. I remember my classes with you. To answer the question, rebound time for tourism is really highly dependent on what's happening in the source market. And as far as we can tell, there are no immediate indications that the borders are going to open anytime, certainly not within the next 3 months or so, or perhaps even to the end of the year, where we can have the level of tourism activity returning to the region. There are some indications that some cruise lines will begin to service some of their markets. The question really is whether or not the consumers are really going to have, or the patrons are going to have the level of confidence to go on a cruise ship or to even go on a plane. So I think I would want to couch that response in the context of whether or not a vaccine becomes available, and how soon that becomes available in some ways are going to be determined when patrons are sufficiently comfortable to go on a cruise or get back on a plane. So once we have an idea as to when that is likely to happen, I think we can begin to think about when we can return to tourism activity in the region.
Thank you, Mr. James. We have rejoining us, Mr. Jensen Samaru. Are you there, Jensen?
Yes, I am. Can you hear me?
Yes. Can you continue your presentation? Thank you.
Certainly. I was making the point that borders only seem to exist in our minds. And this global pandemic has called for a global response. And in that regard, now more than ever, international organizations have had to step up and show their relevance, role, and place in the international space. Now, reliance on international organizations during this period has significantly heightened. And there has been a clear recognition that uncoordinated actions by individual countries is counterproductive and will not in any way effectively minimize or aid in eradicating the virus altogether. We have seen the World Health Organization take the lead in directing the global response to the prevailing health crisis. The prescriptions made by the World Health Organization, particularly travel restrictions and lockdown measures, have been acted upon by a majority of countries and have yielded great results thus far. It has become very apparent, however, that healthcare capacity and capabilities, particularly in developing countries, leaves much to be desired. Greater investments in quality and universal access to healthcare is definitely needed. Quite unfortunately, the decision made by the United States of America through its president to withdraw funding from this organization does not bode well for the agenda of the organization. The US has historically been the largest donor to the World Health Organization, and its withdrawal of funding will definitely impact the operations of the organization, which potentially could be detrimental, as the time could not be worse. On the side of finance, the two primary international operators, namely the World Bank and the International Monetary Fund, or the IMF, have both had to make unprecedented adjustments to their operations in an attempt to soften the blow brought on by COVID-19. Noted, they have doubled access to emergency facilities, particularly the IMF here, and have approved debt service relief for 25 low-income countries, and also approved emergency financing for several countries, including St. Lucia, Grenada, and Haiti. The World Bank is assisting 93 countries and with COVID-19 related health projects, and has begun a debt payment suspension from countries if they request forbearance. The efforts of these two institutions are commendable. It would be misleading to pretend that their mode of operation in relation to the same countries, and I'm speaking here about the Caribbean, Africa, and certain countries in Asia, that prior to this pandemic, their mode of operation was always favorable. It certainly was not. One of the many failures of international organizations generally have been their inability to appreciate the intricacies and complexities that exist within states. Many policies never touch the lives of vulnerable communities of people. If there's one thing this pandemic has exposed, it is the major inequalities that exist in our world today. It has more so revealed the weaknesses of individual countries, social and economic systems. In this regard, I wholly agree with the sentiments shared recently by my learned friend and the current Vice President of the Guild Council, Mr. Nathaniel John, that we must be mindful when we speak about returning things to quote-unquote normal. Many years ago, the world used the opportunity in the aftermath of World War II to establish the United Nations and several international organizations. We now have an opportunity to strengthen and foster international cooperation and embark on rebuilding of social and economic systems, and truly fashion a new normal based on the principles of social justice and solidarity. On this particular point, it would be remiss of me not to use this opportunity to reinforce and reiterate the call by the Honorable Prime Minister of Barbados, Ms. Mia Mottley, for the repurposing of international organizations so that they truly cater for everyone. We need a global leadership initiative focused on reducing the inequalities that exist in our societies and pave the way for a more socially just, united, and sustainable world. Systems and structures that have been in place clearly needs reworking, or rather reinventing. Damian Marley very poetically in one of his songs said, quote unquote, "It is sad to see the old slave mill is grinding slow but grinding still." If we are looking for ideals to embrace globally, I think we have to look no further than the national mottos of some countries right here in the Caribbean. Trinidad and Tobago, together we aspire, together we achieve. Jamaica, out of many, one people. Guyana, one people, one nation, that is the world, one destiny. Belize, under the shade we flourish. A final point I want to make is to call on world leaders and regional leaders to promote and facilitate youth inclusion in any policy making that is done in the post-COVID-19 period, and even those that are being drafted and crafted now. And as youth as well, who are affiliated with different organizations, international organizations, and have positions in these organizations, I would like to state that they have a responsibility to amplify the voices of their peers and not just use these opportunities to travel and attend international forums, but to take pictures for WhatsApp statuses and Instagram stories. These platforms must be utilized to effectively get the messages of youth across. I think I can think of no better way to close than to draw on the wise words of the great 20th century philosopher, Christopher Wallace, otherwise known as Biggie Smalls. If you don't know, now you know. Thank you, and I now hand over to you, moderator.
Thank you, Mr. Samaru. I appreciate that you emphasize that this situation presents an opportunity to reestablish social and economic justice. And we're seeing the need for that at a global and a regional scale. I also appreciate that you emphasize the need for greater regionality in tandem with our national mottos. So we're seeing here that with the variety of presentations, there are all of the aspects of human development being captured. We are moving beyond the focus of economics, again, as just being reliant on what is happening to GDP and other macroeconomic indicators, to a more humanistic approach, a more social approach, and encompassing the need for equality, gender equality, not just income equalities, environmental equalities. So with this, we would move on to address some of the remaining questions that were posed during all of the presentations. those questions that were not answered at the end of today's forum can be addressed to the Department of Economics, and the presenters can respond. I'm going to address a question to Mr. Ronald James. Mr. Ronald James was asked whether in the Caribbean, we are doing anything to study and pattern China's productive economy as a Caribbean economy. Mr. James?
I do not know. Thank you very much, Chair. I do not know that there is a deliberate strategy by any country or any economy to pattern its way of doing business as China does. I know that there have been concerted efforts to focus more, a lot more on planning. I mean, as we might be aware, China has been one of the leaders in terms of how they plan. It's a planned economy, so their skill is really on planning, and they have been taking very long-term views in terms of how they look at their development trajectory. Some of that attitude have been replicated in some of our countries. We have had plans that are 20-year plan, 30-year plans, and so on. So I think that is the closest we have come to sort of replicate what the Chinese do in terms of their production methods. That is very difficult to do because we are looking at a country with over 1.7 billion or so people, and a region that is how much? Somewhere in the region of maybe 10 million or more. It's very difficult for any one country in the region to replicate the way China does things. Furthermore, our political systems are very different as well. The things that the Chinese government will get away with, and a perfect example is what has just happened with respect to how they responded to the coronavirus, for example. They took a very, at the risk of being corrected, a sort of autocratic approach to ensuring that social distancing was enforced. I do not know that there's a government in the region who can take those kinds of steps without significant political repercussions. So our political system does not necessarily allow us to replicate the way China does things. And again, we do not have the population, but we can do some things in terms of how we plan. And like I said, I've seen there are evidence of that happening in different countries where they're taking a sort of longer term view of their development trajectory.
Thank you, Mr. James. I'd like to move on to Dr. Kimberly Ann Gittins-Baines. Dr. Gittins-Baines, a question was posed to you on how can health economic models help us sustain our creative sector in a post-COVID-19 world, especially as it relates to our festivals such as Carnival and Jazz Festival. Dr. Gittins-Baines.
Hi, could you repeat the question, please? I wasn't too clear.
Sure. The question is, how can health economic models help us sustain our creative sector in a post-COVID-19 world, especially as it relates to our festivals such as Carnival and Jazz Festival?
Okay. In terms of health economic modeling, you have a wide range of models that may be used to predict the trajectory of the epidemic and the impact in terms of GDP. I've seen some papers out there in terms of specifically the creative areas. The modeling may be of some usage there in the broader picture of things if we are looking at potential areas of impact. For example, if we're looking at jazz festivals and carnival where persons would be coming into the country, again, that would be dependent on, as Ronald was saying when the question came to him with regard to tourism and cruise ships, whether there's actually a vaccine where people would feel comfortable flying, traveling generally. So in terms of modeling, it will be dependent on what the models would show us in terms of the spread of the virus, and it will also be dependent on how the situation would actually unfold in terms of the spread of the virus. So it's difficult to say that a health economic model would be able to predict what will happen in terms of carnival or other festivals. That is something that would be dependent on the progression of the virus, the availability of a vaccine, and when our borders would actually be open. Thanks for the question. I hope I addressed it.
Thank you, Dr. Gittins-Beans. In the interest of time, I'm going to pose just a few more questions to the remaining panelists. Again, for our viewing audience, for those whose questions are unanswered, you can send an email to the Department of Economics, and your questions would be posted up as a frequently asked question response on the department's website. So please feel free to continue to send your questions, and if they are unaddressed, we would definitely continue to provide the discussion through our email contact. Jensen Samaru, you are asked a question about whether you think international organizations should lead the effort in funding research and development. For instance, research into a vaccine for COVID-19. Jensen.
Thank you for the question. I do believe indeed that international, which of course have come about as a result of a collective effort by governments, that they should lead in the funding of these research and development, because a lot of money go into these institutions, and oftentimes people they do not see or feel the results that come out of them. So this is an opportunity for certain organizations to step up and show their role, their relevance, and how it is that they can contribute to having this pandemic either eradicated completely, or at least in terms of the scale of impact lessened.
Thank you, Jensen. Our next question goes to Rukaya Scott. Ms. Scott, do you think enough is being done with regard to gender equality in the Caribbean?
Hi, my immediate answer to that question is no. Why? Because I as a young person and as a female, I can feel that it's not equal, and I'm sure I speak for a lot of men and women. The thing about gender inequality is it does not affect anyone in isolation. It affects men, it affects women in different ways. And I don't think we are addressing in the Caribbean and globally also what is causing all of this inequality. What we tend to do is that we wait for an incident to happen and then we attack it from that angle. But that's not the way to do it, because then it's going to keep happening. What we need to do is that we need to figure out what is causing all of this inequality. And we know it's the system of patriarchy. The system of patriarchy has affected men and it has affected women with different levels of toxic roles and responsibilities that we are supposed to uphold from now until we die. And it has been engraved in our society to the extent where it's the littlest of things that we do in our social interactions that speaks to how we view men and women in society. So do I think enough is being done? No. But do I think we are taking steps in the right direction? Yes. I'm very pleased to see that the Trinidad and Tobago Police Service have amped up the scale of their gender domestic violence operations. I'm very pleased to see the gender unit in the Office of the Prime Minister. And I'm very pleased to see that we actually have been trying to start the gender responsive budgeting in Trinidad and Tobago. However, more can be done. And my last thing to touch on in terms of this is one major factor we must consider when we're talking about gender equality in the world is that it cannot be done from an all-male perspective and it cannot be done from an all-female perspective. And I know this has been a controversy. A lot of people have been speaking on social media in terms of how many women do we have in managerial positions, in the parliament, on any committee that is formed to sort of lead the country forward. And I definitely think it's a very valid question and it's a very valid reality. And I think that when we're moving forward, in order to have anything that is gender equitable, we must ensure that the persons in charge of making the decisions are also gender equitable. So let's discontinue having an all male or an all female approach to an issue, because the thing is, the human resource of Trinidad and Tobago, the human resource of the world is made up of males and females. And if it is we want to protect males and females, we need males and females. So that's why we need to start providing more opportunities for women, granted that the situation it's very male dominated. So we need to provide more opportunities for women and educate more women as to how it is they can become economically and politically empowered to be able to make decisions that we can work towards leveling the playing field for men and women. Thank you.
Thank you, Ms. Scott. We have one final question that I'd like to pose to Dr. St. Martin. Dr. St. Martin, how do we redirect our food preferences given that they are not based here? What are the first steps that you would suggest to address this problem?
Thank you for that. The first thing and the easy answer to that is that when I spoke about a sustainable palate, is that most of that is perhaps under your control, meaning that you have the option of choosing what you actually eat. So the fundamental issue is, what are you choosing on a daily basis to consume? And how are you relating that to a macro issue where your country is suffering because of certain things? So how much is the individual connected to that macro issue, and how much is the individual and the individual units really, how are they really get at making that change that we speak about? So again, I want to answer that by basically saying that, yes, it starts with you. And then when you start demanding that, obviously creating the enabling systems and environments, whether it's on a governance level, a policy level, when you start demanding that, then that actually takes shape. So even now, there's enough space for you, seeing the ills that are associated with that, try to change your preferences and align it to certain aspect of. Obviously, it talks about willpower, etc., but it is not something that is far reach. It is something that could be done, and it could be advocated to actually change or adjust the enabling environment to support such sustainable palettes. So I want to say that, I want to leave it on that note, that a lot of it is the individual can do it. Individual unit household level could change their buying patterns from the supermarket to go into the market, etc., in line with that problem, particularly because there's an aggregate issue in terms of when you start to aggregate these individual choices and the different sustainable palettes, then you essentially would get a more sustainable outcome. Thank you.
Thank you, Dr. St. Martin. With that, I would like to close the presentations and the Q&A session and ask you to still continue the conversation, however, by getting in contact with the Department of Economics via email, where you can send your questions and we would have our panelists address them and post up the responses to our departmental website. I would also like to encourage you to continue to monitor the activities of the University of the West Indies and the various webinars that units and departments have been hosting. The collaborators of this forum, the Health Economics Unit, the Department of Economics, and the Economic Society Unit, look forward to continuing our Youth Economic Forum and your continued engagement. To close, I would like to express our appreciation to our well-versed and stimulating panelists who have certainly established some more certainty on what is required on the way forward. I encourage all of our participants to treat this experience as an opportunity for positive change and creating a new normal of a sustainable future for ourselves and our societies. One of the main lessons I would like to leave you with from our discussions is that development does not require moving along a traditional path of copy and pasting what the rest of the world has done, but rather appreciating our indigenous uniqueness and building upon that. As we end, please note that a recording of this can be viewed on the UWI St. Augustine's YouTube channel, and questions can continue to be forwarded to the Department of Economics email. To all our viewing audience and panelists, planning committee, and facilitating technical staff at marketing and communications, and the campus IT, thank you and good afternoon.